myself. So very warm welcome from me and from Prague. I'm based now in Prague. I'm Lenka, and I worked with trauma for a few years, or many years actually. I finished training in London 2011 with craniosacral therapy, and 2017 I finished training in somatic experiencing in Czech Republic with one of the trainee of Peter Levin. And also, I train in different modalities like Kundalini yoga, different massages, Thai massage, and basic technique for biodynamic psychotherapy. So I have like also some short postgraduate courses. I'm also specializing on mother and children and birth trauma. That's quite big topic which I can cover also in our lecture. So today I would like to talk about somatic experiencing and body approaches to trauma. I love so much working with body because as I experience a lot of people coming to my practice, or they refer when they've been coming just only for talking therapy, they still didn't resolve like body sensation, or they suffer still of anxiety or like stress. And body approach to trauma, it's saying, or Peter Levin saying, like trauma, it's not store only or like brain issue or like, but it's also make an imprint in our physical body. So actually, people from suffering from trauma can experience like body sensation like anxiety. They can experience like they have a problem with insomnia, or like they have a disturbing dreams. They may be shaking. They have a increasing like heartbeat, maybe problem with digestion, and maybe there are like much more symptoms, because actually trauma, it's how Peter Levin say, it's a situation when body experiencing some event, very traumatic event, which couldn't actually process, couldn't discharge, or couldn't complete. And trauma for everybody can be something else. For somebody, trauma can be separation from mother. From somebody can be trauma even in prenatal development trauma, when mother wants to go for abortion, and the children it's unwanted. For somebody else, trauma can be teeth extraction, or like some operation in early childhood, or like later on. The other type of trauma can be a nature disaster like earthquake, I don't know, floods, or like fire in the building. So a car accident. So trauma, it's very individual things. We can't measure or like judge somebody has a trauma and somebody not. Trauma, it's very individual perspective. And how we describe in somatic experiencing, the trauma, it's some event which happened very quickly. So it wasn't enough of time, and also not enough of space to process the discharge of this potency which has been accumulating in the body. So, for example, a car crash, it happened usually very suddenly, and the person in the car crash couldn't or didn't have so much time process this trauma, or process and dissolve or like discharge this potency. So that's the trauma. The type of the trauma are many things. So it can be sudden trauma, like which I described. It's like nature catastrophe, so shock trauma. We could say shock trauma, or it can be also developmental trauma, so from family, and it can be prenatal trauma. So they are like little different kind of trauma. So if I talk about shock trauma, maybe you can tell me yourself what you think it's shock trauma. Or like if you have any idea like what means shock trauma, you have any examples?
I do. Um,
Yeah,
when this happened quite a few years ago now, but I got a phone call from my sister, and her
yeah.
son, who was 15, died very suddenly.
Mm-hmm.
No, there wasn't any illness or anything. He literally just collapsed at home and died, and it was a real shock.
Yes, yes,
There was nothing we didn't, no, there was no warning signs or nothing. And he was only 15.
yes,
That was a
yes. And
shock.
so it's, yeah, it's big shock, isn't it? And death, it's actually the huge shock and trauma. Yeah. So anybody else can describe like shock trauma? Thank you for sharing.
I was thinking maybe like a sudden
Mhm.
health diagnosis, unexpected health diagnosis.
Yes, exactly. For example, cancer or like anything what you don't expect.
Yeah.
Exactly. Yeah. So I will give another example, which I already mentioned. So it can be, for example, accident, like fall on the head, um, some cut, breaking the arm or like leg, so accident, assault, surgeries, nature disaster. Can be like earthquake, it can be like fire or like tsunami. They have a lot of like shock trauma. And the symptoms of the shock trauma can be people experience even the trauma or like the situation clear up. So, for example, there is earthquake, and in few hours there is no earthquake. They still suffer of the symptoms, so they can have a like flashback, they can have a sleep disturbances, they can have a like nightmares. So the system still remember this shock because something happens sudden and it stay in the body and it has been discharged. Even they get healthy. But you said very good example. And then we have a developmental trauma, and this is trauma from childhood. I'm working in my practice a lot with childhood trauma because people coming usually with some issue from the family, mother, father. Usually it's like neglection. It's like they've been abused physically, maybe hit by father or like mother, or they've been unwanted children. And the parents, which are really, I'm very convinced, it's basic things what we experience in early childhood. It has a huge impact on our nervous system. So my client, they coming usually with issue with childhood, and it can be also neglection or like also adoption, for example, or child it's with very young parents and they haven't been prepared. I recently worked with somebody like this. uh, just parents hasn't been ready. They have a child in 18s, and father got very aggressive to daughter and he hit her. And this woman, she also tried to commit suicide, ran from home. And 18, she actually tried, really, like she makes some thing to committed suicide. And father find her and he even hit her. He was angry, so she didn't understand. And that was because they had her like very early, and they've been, for some reason he was very aggressive. So with this childhood trauma, we experience with people, they have a problem with boundaries usually, because boundaries, it's also a very big topic in somatic experiencing, what we work with. Boundaries and trust. Then it's topic like chronic shame. I work recently with a lady who was abused, sexually abused with her stepfather. And the story was then she was kind of taken like a naughty child, so they didn't respect her, and they wanted boy, and she was girl. And then her mother married again, and her stepfather started to approaching to her, and she felt like she's accepted with some person in the family, but he overcrossing boundaries, so she got very confused, emotionally also. And it came to 18, and then she moved away. But you can imagine like she was very damaged because she had she thought maybe she liked him, or he loved her. She didn't understand, and it was kind of taboo in the family, like her mother didn't know. So it's also this thing can happen. And also the impact, it's dysregulation in a relationship. Can you tell me some example of family or like this development trauma? Do you have some experiences, or do you know from your own life, or like your client, or like something what we can say it's trauma from family? Nobody?
Can you hear me okay?
I was going to say,
Yes.
when I was growing up, me and my best friend used to ask me to stay at her house, and I used to stay at her house when I could. But her
Mm-hmm.
stepdad never ever wanted me to stay at her house, and he didn't ever really want her staying at mine. But it wasn't until she was 13 we found out, like she obviously disclosed it, that he'd been abusing her since she was 4.
Mm-hmm.
But
Okay.
looking back, like she was like, I was her protector. She was trying to get me to sleep over and come to sleep over at mine, because, and
Mm-hmm.
as she grew up, I mean, she had a lot of trauma after
Mm-hmm.
that, but she came through anyway. In the end, she came through, and she had a lot of help, but she got
Yeah,
through.
that's good.
But that
Thank
was
you.
really traumatic, because to find out as well, when I
Mm.
was 13, I found out that she'd been abused, even though I hadn't been abused. It really affected me it affected me for quite a while.
Hmm. Hmm. Understand. Thank you, Terry. Thank you. I'm just letting people in. Okay. More people coming in our talk. Yes, so it can be. I work last year in Buddha Field, which is Buddhist festival, and I had, because I did cranial, I had a lot of people on the table with sexual abuse trauma. I was quite shocked, and sometimes it's appear. I just did like healing session, and because the all environment was very safe in the festival, they start to process like some trauma from childhood, and I was a little bit surprised how many of these sexual abuses are there. So, but it's not only sexual abuse, it's also things like children being hit, children being, they had very strict parents, you know. So this thing coming from family. And then I'm coming to birth trauma, which is topic which I really like, because I have also training for mother and babies in craniosacral therapy. And birth trauma, it's very interesting topic, because birth, if it's like when it's getting complicated, which can be also position of the baby in mother womb, or like there are like some substances used like epidural or like some chemical things, it can be a little bit unnatural. Of course, doctor want to save the baby, and they do the best to save the baby, but sometimes they are not having good approach for trauma, and they don't know how to look after mother and baby. So, for example, today I had client who had difficult birth. um, it was actually cesarean in the end, but she was planning like very nice. She has very nice relationship, husband, and she was kind of. It was like some complication went on, and the baby start having heartbeat, and they have to use cesarean. And so she was a little bit. Then she had some infection of the womb and more complication, but it wasn't like proper bonding. It was some separation, and she didn't feel she's very well looking after with the person like in the hospital. I mean, doctor, it was very mechanical. Like obviously they look after her, like, but they didn't give her maybe after the birth care or didn't explain. She said she was shaking like one day, and the child also has an impact of this birth, because it's not only nervous system of the mother which has been affected, but it's also baby system. So when I treat baby and mother, I always treat both of them, means mother and baby, because they are still connected. I usually use like some like craniosacral therapy, which has been shown like very effective way. And basically, birth, when it's not smooth and natural, it can create also this fight and flight response. So if the baby is pulled from the mother with forceps, it's actually some kind of forces being used, which can be taken like it's threatening my life. Yeah. So we can talk about forceps, we can talk about cesarean, we can talk about using some chemicals during the birth. So these things. It can be our own birth, or like also like separation from the mother when we need bonding. Yeah. I'm coming from generation I was experienced like I'm still it was still communism, and when the approaches this time to the babies were like very like mechanical, I think. Yeah. So also when, for example, child was sick or like ill, they separate baby and put baby separated from the mother. So I really like to work with this topic of the trauma, because it's actually my also trauma, like because I was given in 6 months alone in the hospital. I don't consciously remember, but my body remember. Yeah. So I had this separation issue with my mother, early stage, and I have also experienced prenatal trauma because my mother lost her brother, and obviously now we have like also therapists like Gabor Mate, which you know probably. He he worked with this childhood trauma, or like making a lecture about how it's important engagement, or like emotional engagement of the mother with the baby. So again, I would like to ask you if some of you experience some, or somebody from your family, client, difficult birth, and maybe how you cope with this, if you want to share.
Do you know what? I never ever thought about, because I had a forceps delivery with my first son,
Mm-hmm.
and he's always had issues, and it never even crossed my mind, I don't
Mm-hmm.
think, that
Mm-hmm.
because I had a forceps delivery, that that might be why he's so
Yeah, yeah.
troubled. I didn't even.
Mm,
I feel quite emotional listening about that, because I didn't
mm,
actually think about that.
yeah. Actually, it's good realizing like it's not somebody's fault, or like it's your fault, like a mother. Like sometimes this thing happen because baby it's big or it's in wrong position. but it's definitely have an impact of the babies. Like when I had a lot of client, like baby client and toddlers and mother, and usually the child has difficult birth or experience separation, had a disturbing sleep or like crying a lot, and then mother, they don't understand. But this is happening because we been too much under the pressure, and there was some violent in apostrophe forces used to baby and mother, yeah, for saving life for good, but nobody treated the trauma, yeah.
Mm.
So the imprints stay in the body, unfortunately. And with I use technique craniosacral therapy, which I can explain more because it's very gentle and can also relax body or like get body to feel this for like connect to health and help to release the stress in the body, because this imprint can stay whole life, until like end of the life. We can have an imprint of this birth dynamic, yeah. But actually forceps creating a lot of pressure on the head, yeah, so people can suffer also with headache, or like they can be very sensitive on touch of the head, yeah, and like this. So we talk about birth trauma. Uh, Somatic experiencing was developed by Peter Levine, American biologist who observe like animal, how they behave, how they react on stress, and he discovered like we have very similar nervous system, but human they have a little bit more complicated nervous system, because because of the limbic system. But the primary reaction on stress, it's guided by reptilian brains, which is the small part of the brain common for even reptilians. And when it's some danger happening, the what we do, if it's, for example, I don't know, some fire, we go and we run from the building. That's normal like reaction of our amygdala, the and uh, the run. We can go, fight or flight. It's a response of the body to cope with danger situation. So fight flight response, it's basic for even like any mammals, any small like animals, we all do same, yeah. And when we can actually act, or like we can escape, or we can fight if somebody start to attack us and there are like 10 men want to kidnap us or something to do, our body or like our brain decide we can't run away, we can't fight them, so we freeze. And the frozen state, it's reaction, supportive reaction of the nervous system to protect us from the pain. And same it's with the animals. Peter Levine show a lot of example of animals, maybe cheetah, like chasing antelope. And when he take her, when he get this antelope, she fall on the like grass, and she immobilize. So she get frozen. And this frozen state, it's like protection from the pain because predator will eat her, or like for he won't pay any attention to this animal. So he described in the video, these animals maybe are frozen, and maybe you saw already animal or yourself when you freeze and your body like basically doesn't feel anything. Or you can dissociate. So dissociation means also I'm coming out of the body because it was so discomfortable, and it's survival reaction of the body. So freeze or dissociation. And when I talk about this predator, when he see antelope like frozen, she doesn't move, he will walk away. And this animal, after a while, she will reconnect with nervous system. She will start to shake, which shaking means like I discharge this potency which has been accumulating through the stress, and she will come back on the feet and she run away. So this technique, it's for example described in TRE, TRE, trauma releasing exercises. Maybe you know this, when they create like shaking in the body to restore this energy in the body. They use this technique for highly traumatized soldier or like different people. So I just would like to again ask you if you have any experience with this. If you can tell me if you ever shake or freeze or dissociate.
I have
Anybody?
Yes, I have. Hi.
Ah,
I'm sorry I'm late. The link didn't work. The other link didn't work. So
no problem. Sorry, we make a little bit confusion with the link. Sorry.
okay. Yeah, so I've done TRE and I work with trauma pretty much every day. So but it's interesting in how actually people don't tend to shake, which is the problem really, that they don't tend to shake. And so the energy gets stored then in the body, and it can often feel like trapped energy or something, like a kind of pressure in the body. Mm-hmm.
Yeah, that's right. Yeah, thank you so much. Have you ever shaken after some stressful situation?
I have actually, well, in processing. So I work with trauma, but I also have had trauma myself. So in processing trauma, I mean, it's good if you shake.
Yeah,
Yeah,
exactly. Amazing. Yeah. So actually, freezing, it's a self-protection of our nervous system to cope with the pain. Yeah. Or dissociation. But the problem is we don't stay too long in the body. And in somatic experiencing, we always try to get the client back to the body sensation, sometimes very long. I have now client who had two operations as a child, and his parents fight a lot, and he can't describe what's going on in the body. He doesn't have so many friends. He feel very numb, So like freeze response, it can be numbness, tiredness, like feeling tired, feeling they can't describe what's going on in the body. Yeah, because it's difficult. So now I would like to try some exercises. So when we getting in freeze or disconnected, we can, for example, like put hand on the shoulder. You can put it and just squeeze a little bit like our muscle. You can do it with your client and just squeeze the muscle and just feel your skin, maybe temperature of the skin, and just feel like the skin has like some boundaries. And this is me, this is myself, yeah? And then you can do little like tapping, just tapping on the body. Again, I'm aware of my skin. This is me. I'm aware of my shape. And then you can place like one hand on the chest and one on the head and just breathe. And breathe into your hands. Inhale. and just feels connected with your feet on the ground. Maybe you feel some carpet or like floor. And then you can place one hand on the chest and one on the belly and feel the same. Just be aware of your breath. You can just experience what kind of material with your feet you touching. And maybe you can observe slowly, like it's calming your nervous system. The other, yeah. So how was it for you? Like, how is it for you? Is it calming or like getting you more into your feeling of your body? Was it good for you? Good. So this calming, thank you for the heart, Colin. So the other thing, what we do in somatic experiencing, it's orientation. Orientation, it's all animals, they need to be oriented in the space. So with client, we start basically like mapping our room, like, so we can ask the client, like, look around and what feels like comfortable for you, what feel like nourishing for you. Any object, it can be vase, it can be flower. So it's called orientation because all animals, they orient in the space when they feel like danger. We're looking around, we're mapping the system. And now I'm coming to the topic of the how it's organized nervous system. Nervous system, it's we call autonomic nervous system because it has two sides. One side it's sympathicus, and other side it's parasympathicus. Sympathicus, it's something what is responsible for action, for fight and flight. And parasympathicus, it's responsible for calmness, be relaxing. There is no sense of danger. So the fight and flight, it's action of survival. And I would like to ask you, what do you think it's symptoms, how we can know somebody is in sympathicus nervous system? What is activated nervous system physically? What we can sense in the body with activated sympathetic nervous system? Do you know? No?
I would say like shallow breathing.
Yes, correctly. Anything else?
Like you said, sort of shaking, sweating, fast heartbeat.
Brilliant. Yeah. I will also increase, I will edit dilated pupils. So the pupils enlarge. Yeah. Muscle tension. And maybe there can be some anxiety feeling. Yeah. Or like panic feeling. And in other hand, we have this parasympathetic system. It's responsible for rest, digest, and repair. So I have a cat, and I can see like how much this cat is in the parasympathicus mode. They sleep a lot, they can lie in the like very relaxing. And when something they go to like chase somebody, so what they do, they will, their ears will pop up, they will mapping the system, and the like eyes enlarge, like pupils enlarge, and they go the muscle tension. Yeah. So I would like to ask you what parasympathicus, when we are very relaxed, like how does it look in the body? how the muscle feel, how it's the heartbeat.
So kind of maybe a kind of slightly slumped, or maybe, it depends if someone's actually in collapse. It might be worse, as a feeling, and quite big eyes, staring.
Okay, so basically, like muscle are relaxed, digestion working well. If we like heartbeat, like there is a deep breath, so we have it's very good circulation. So actually, like cause of trauma, it's very shallow breath. Usually, people they don't breathe too much, and they have also problem with digestion. It can be like slow digestion, irritable bowel syndromes. It can be allergy to different food or like diarrhea, because we have a like long nerve coming to the belly. Yeah. And it's called vagus nerve. Yeah. Maybe Stephen Porges and his theory. Have you heard? Yeah. Yeah. So this nerve is responsible for social engagement and it's developed in early stage of childhood. So it has two branches, ventral and dorsal, and it's developing by social engagement with mother or like some loving person. Yeah. When it's not developed, there is a irritability. We have a problem with digestion. Yeah. So we have to work with this nerve. Yeah. So we talk in somatic experiencing about we can show like trauma. It's like this. I don't know how to call this, but it's a flexible nervous system. It's like this. When we have like some traumatic events in the life, the nervous system capacity getting smaller. So birth trauma, like parents are fighting, like bad school, parents move, and this kind of trauma accumulate, and then it's flexibility of the nervous system very narrow. So we call it green zone, which is, we can imagine like river. The flexible nervous system, it's very, very flexible and can be self-regulated. But when we experience a lot of trauma, there is a very narrow capacity, of the self-regulation. And then we call it the person, it's in the red zone. So red zone means in an alert situation. There can be anxiety, irritability, racing thoughts, difficulty sleeping, impulsive behavior. And this can be also caused with constant stress. For example, at work, it's same like we are on fighting zone or like in the war, when it's constant pressure on us. So when we are in green zone, we feel calm, curious, compassionate, connected, body feels grounded and present, and we are happy for learning and connection. But to be honest, it's how many people you know from your environment who they are in green zone all the time. It's or do you feel you have yes, so that's the question. And then we say it's blue zone, which means when going to freeze or like dissociative state, we go to blue zone. Means we freeze, shut down, we dissociate, we have a depression, fatigue, low motivation, feeling numb, blank, disconnected. So what we do in this work, we work a lot with resourcing. Resourcing means we have to find in our life the motivation or like activities which giving us stability. So when we work with client, we work with resources. For everybody, resourcing, it's something else. For somebody, it's resourcing, riding bicycle. For somebody else, it's gardening. For somebody else, swimming. Somebody has a cat. Somebody has a like good friend. But we have to work with client, like stabilize this resourcing. That's very basic work with somatic experiencing. So finding resources in the body and in the environment. And then other technique which we use, it's a technique called titration and pendulation. Have you heard about it? Anybody know? So Peter Levin described when we releasing trauma, we can't do it like go to trauma like straight away, because the potency will go very quickly, discharge, and it won't have any effect. It will go to the vortex of the trauma. So we have to discharge this very slowly. That's it's called titration. So means we titrate, we're slowing down the process with the client. And then it's other technique which called pendulation. Pendulation means we pendulate between traumatic events, touching little bit events, and then go to positive resource. Because going directly to the trauma, it can cause re-traumatization. So very important things in somatic experiencing, it's also safe place. It's very important that client feels safe with therapist, feel safe environment. And I would like to ask you as a therapist, what do you think it's safety for the client, or like how your client experience safety? Do you want to answer?
I think boundaries are really important.
Also, yes.
So I think boundaries help clients feel safe. So, and all the usual things like being in a quiet, confidential space and being listened to, and respected, making space for them.
Very good, Emma. Yes, exactly. So like also confidentiality, as you said, and like feel maybe there is no anybody listening the session, or like they feel comfortable, they have a drink, there is you keep the time for them, there is no changes, or like you are not late. So safety, it's very primary things for the healing. And sorry, I have to, yeah. So safety is very important place for the healing, and it's very essential. Like without it, we can heal. So, for example, when I do craniosacral therapy, I create with my hand. I hold the body, and I just give body really lot of space, but very gentle, like support. But I don't like pressurize of the space, or like I just give them really a lot of spaces to process trauma, or like feeling safe. With my hand, I create safe space. With somatic experiencing, you can do also, sometimes we put feet on the client, with the client feet, like to grounding. And we can use, for example, asking like, do you feel like support of your chair? Do you feel like how it's your back? Maybe we can give it blanket or something like this. Yeah. Also in somatic experiencing, we use a model called SIBAM. Have you heard about it? SIBAM? Yeah. SIBAM, it's model when we work in 5 channel. S means sensation. So we encourage a client feel physical sensation. So we can ask like how they feel physically. Do you feel cold? Do you feel hot? Do you feel tingling? Yeah. Because some people are really disconnected. We can work with I. This is image. So what is like any idea, imagination? Yeah. Just okay. I didn't. Emma, you have to tell me because I didn't have a chance to read everything. Behavior means like the movement. We observe the movement in the body, like micro movement. It can be something with eyes, and be kind of mirroring this. Affect is A. Emotion. So how you feel emotionally in your body, how you feel, where you feel this emotion, and meaning. What does it mean for you? So that's called model of SIBAM. So this technique we use also for somatic experiencing. So maybe now I will give you place for the question if you want, or you can share some maybe your experience with trauma and your client, how you work with client. So feel free to ask questions.
Lenka, you mentioned something about the feet, and sorry, I didn't hear. I misheard what you
Okay.
said.
So
About
yeah.
positioning the
Okay.
feet.
Okay. So in somatic, to help somebody get grounded or like feeling somebody, because usually it's a process feeling with sitting position. You can place with permission feet on client feet on top.
Oh,
And
okay.
then they feel, I use a lot of craniosacral therapy, but you can use it like put feet on them if they want. Yeah.
Thank you.
Lenka.
Okay. Yes.
Hi, Lenka. What was the E for there?
What was what?
E for SIBAM. What did E
Ah,
stand?
okay. Image. E was image. S sensation.
Yeah.
E image. B behavior. A affect. M meaning.
Perfect. Okay.
And you have to work with client with all this model. Like so actually work with all channel. Some client they can have a one channel like close or few only open one channel. But the whole point is strength like all these like channel. Yeah.
Okay.
We have to extend session. Yes, like we can, and they will have a also recording. So like when body it's shut down, we have to like open it a little bit. We use this model in somatic experiencing. Yeah.
Okay.
But I like craniosacral therapy. You can ask me also about it. This is my method, which I've been doing 14 years. I love it. So I can tell you more if you want, or like you can give me different question.
There was just one question, because I'd never heard of it before, but I saw a client yesterday who had actually had her vagal nerve cut when she was a little girl. She had an ulcer at the age of 8. And I was just thinking, what a incredibly, how mind-blowing that really is, that they used to do that.
Wow. Like obviously if it's operation, there is maybe some damage already, but you can work what, like I will always respect body. I don't have a personal experience with this.
No,
So
I've never heard of it before, but
yeah.
I know it's a thing.
How does she behave? How what is her symptoms?
Well, it was my first session with her. She's got a lot of childhood trauma, hence the ulcer at the age of 8. You know, she was only a little girl, and so she present a lot of anxiety. A lot of anxiety, always has felt anxious, which I expect is partly obviously trauma, but as well as that, I would have thought a consequence of having the vagal nerve cut would add to the anxiety.
Of course, yeah. Well, creating safe space, obviously she needs, yeah, like a little bit mothering and replacing this feeling of the safe environment and her mother. Sometimes we act like a therapist. I feel sometimes like mother for this, like like client because they didn't have a good parent. So you are in the role like act a little bit like parent, yeah, in the session.
Yeah, of course.
And yeah, so create a safe environment. And what kind of technique you using? Like, sorry if I.
So, well, I use a combination of things, but I'm trained in somatic trauma work, so I try and help clients start to. I mean, my own experience is without using the body, you really can't get very far. I think including the body is essential, but I can tell that she's very cut off from her body, you know. Time to establish safety and the relationship before she can probably start to be able to connect with her body more. She also drinks alcohol too, so
big topic, yeah. So it might be for a long time, yeah, maybe, yeah.
I think especially at that level of childhood trauma, that it's, takes long.
Understand. Yeah. Thank you for sharing. I don't have an experience with nerve cut. Yeah.
Yeah,
Maybe
it's
for
extraordinary. I'd never heard of it before.
yeah.
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 But thank
Mm-hmm. What about other people? Any question? Or like
I have one question. Craniosacral therapy. I've often, you know, my son had that when he was small, and I know it's very helpful for birth memories. How helpful is it for adults? Because I often read things, you know, where it's helpful for children, but there's not much I've read for how it can help adults. So I'd be very interested to learn more.
yes, sure. So I work each session. I give cranial. I use like kind of like I use always like somatic experiencing tools. So for example, I talk a lot with cranial, but I have a lot of adults, yeah, and usually they responded very well for this. So basically, the session look like you lying on the table and somebody put hands under you. Usually it's spine or like leg or pelvis or like head. And then the therapist give a lot of space and palpate basically what's going on in the body. I have now, when I touch the body, I sense what's going on. Maybe there is anxiety, maybe some tissue are tight, maybe there is a, um, because with a lot of practice and a lot of session, you already sense what is in the field of the person. So sometimes even I get a little bit messages or like, I don't know if it's channeling or something, but I get emotion and I ask the person, what is it right? Like, for example, I see person like doing this and it's afraid. And usually I ask and I got confirmation. I think these emotion are already in the field of the person and we just palpating this, and whole point is but basically open the space of the body to heal with connection. We call it primary respiration, which is life force in the central nervous system. There is a like cerebrospinal fluid, so we hold the body and let the body open up, yeah. So it's very effective. It can be treated headaches, like problem with digestion. But how I do session, I usually guide person to some resourcing in the body. So usually like because I know already story. So imagine some safe space where you've been, maybe in the nature. How does it look like, you know? And then when they go to safety, they maybe feel something difficult. So we go back to the safe space, and then I communicate what I feel. But a lot of craniosacral therapists work in silence, so they just asking what is comfortable. But it's very beautiful therapy. Like I like it. Like it's like with babies, it's different than with adult. Like because adult they will lie on the table whole session. With babies, it's and children, it's more dynamic. So sometimes with toddler, you have to engage them in some game and reading books, or it's dynamic, they moving, then they are breastfed with mother, but it's all about holding the space, and through our hands we creating this space. With somatic experiencing, you do the same, but you don't use so much hand, you just use like your voice or like some body movement, yeah, and it's in the sitting position, or it can be like um also in different position. You can sit on the ball, or like you can do some walking, and but it's cranial, it's more like static. So you hold the hand on the body, and I just love it. I can read a lot of things when I touch the body, like now, like emotion, or sometimes images coming up. I don't know, but it's like it's came with practice many years. Yeah.
Yeah, that explains it very well. Thank you. It's
Welcome.
certainly engaging with the person as well, verbally too throughout. Thank you.
Yeah.
Mm. Sorry, my camera's not switching on.
That's okay. That's okay.
Internet connection's not good here.
Yeah. Yeah. It's with mother and babies, you also work differently. It's more like treating birth trauma and their relationship. So it's also a little bit different work. With babies, Peter Levin also, for example, he put hand on the, well, you create like pressure, like some, like, and you put pressure on the hand, and they have to, basically you let the baby, or let the child, or like person, like push you through. So you create some pressure, and you let the person go forward, which activate this. I can do it. Yeah. I have a message. The meeting ending up soon, so I don't know. I will continue until. So I would like to say I'm happy to do more lecture, or like I'm planning also some practical courses. So if you want also be in touch, you can message me on my WhatsApp. I think you got it in email, or like email. I also am trained in Thai massage. I'm trained in different massage technique. So, so I'm happy also do some lecture, like practical things in Prague. Also, I'm organizing this Ayurvedic retreat in India. This is my passion. So I have a group I'm cooperating with some clinic in India, and I bring like people, mostly women, for like 2-3 weeks, basically program when they get nourished with Ayurvedic procedure. And it's very beautiful. I can send you also a link if you are interested, because we all need like a little bit look after in mid-age of the body, and it's really nourishing ourselves, and people look like 10 years younger. That's my experience from previous group. So it's my also passion. Yeah, you can see me in Prague, like I'm living in Prague, a beautiful city in Czech Republic. And yeah, so you can drop me a message if you want to be in touch and send more events. I didn't spot on messages because it was too quick, but also I'm still free, like answer your question. Or did you like the lecture? Was it interesting for you?
Yes.
Yeah.
Yes. Thank you.
Yes. Thank you. That's good. I'm a little bit afraid, like with my Czech accent, but you understand. Yeah. Thank you. Yeah. So, more question about the work, about somatic experiencing, or any body-oriented therapy?
It's not really a
I-
question. It's just, sorry, it's not really a question. It's just great to, there's so many people doing somatic work now, you know, it's completely kind of taken off. And my own experience with it is it's just transformational, you know, with my own personal work. You know, you can only get so far with talking, particularly with trauma. So it's just really good
I
to
know.
hear. That,
Uh, I think part of the trauma healing, it's community. That's, I think it's important to have a people who are able to listen. Sometimes, just somebody it's able, like, fully engage, and friends holding your hand can be
yeah,
like really important, for like presence, or like, but I know these days, Gabor Mate, Bessel van der Kolk, like all these, they do amazing work. Like they talking about trauma in holistic way, and it's more open topic, than many years ago. Like, I think.
yeah. I mean, I think talking therapy is great, but if you actually have trauma, I think it's pretty difficult. My own personal experience is it's difficult to shift trauma with just talking.
I have to say, I did talking therapy as well, which was great in some way, but client who coming to me, they usually say they've been coming many years for like talking therapy, and sometimes they don't have a result, because talking therapy doesn't work so much with body. Like, it can describe emotion, maybe somebody listening to you, it's great, but the trauma store in the body, and
Yeah.
you have to sometimes shake it out, or like shouting, or like something. I think also, like, with anger, like anger, it's kind of natural, yeah. Emma,
Absolutely.
yeah,
Hi.
like, sorry, I just, one thing I think, especially in England, yeah, when I live in England, people, they don't want to express emotion. It's like everybody, it's like so nice, they have to be polite, but like anger sometimes can be healthy anger, yeah, like setting boundaries. Boundaries are a big topic, yeah.
Yeah, I
Like,
think
also,
like in England, it's very, I think women especially are very socially conditioned to not be angry. It's not okay to be angry. And I like to encourage, especially my female clients, to connect to that anger in a healthy way and like give it some
yeah.
space. I was going to ask, right, something I do with clients quite often is ask them where they feel their emotions in their body, if they can place their hand on where the emotion is, and if they can give it a color and a texture and as to whether it's like a liquid or a gas or solid. And I get them to really describe that emotion, and then sometimes we breathe into that emotion and see if we can move it out of the body and what might be underneath it. And I was wondering, would you call that talking, or would you call that somatic?
Somatic, yeah, because it's go to the body. I do the same sometimes, like, imagine some color, and they can say, maybe they see black color, like negative color, or so you will go, what is the opposite of this? This is called pendulation. Yeah. When they
Right.
go trauma, you reverse them, like, tell me the opposite. I see black. What will be opposite of this black? Yeah. And that's pendulation, because you don't stay long time in the negative.
Yeah.
Yeah.
Yeah. I get them to, if they have a big black smoke that's taking over their torso, I see whether we can breathe in like a light into
Yeah,
that,
that's
to like
amazing.
disperse this. the smoke. So obviously it doesn't work with every client, but actually
Yeah.
a lot of people can get quite creative and get quite involved in it.
Yeah, that's amazing. That's really nice. Yeah, thank you.
Well, thanks.
Emma, I can relate to that because I sometimes incorporate that into my therapy as well. And sometimes what I might do is get the client to like draw a picture afterwards and put their feelings onto paper following that. And I was also wondering if it was somatic or not. So thank you for that, Lenka.
Yeah. Actually, they do in somatic experiencing. They use how can I say, like a figure of some person. I don't know the expression in Czech. You know, like you have like person with hand and feet, but it's like from like sweet. We have so it's basic shape of the body. Yeah, like a teddy bear, and then you let the child draw inside how they feel in color. Yeah, so they can put maybe some color on belly. Yeah, so and then you know what they feel in the body also. That's good. Good, Jasmine. Did you get it? What I mean? You let a child draw. You have a like basic shape of the body, or it can be like bear, like shape or something, like with hand and feet and belly and head, and you let them coloring inside. Yeah, so they can show with colors like how they feel. Yeah. And with also with children, we work. It's quite interesting. We work with games, like we can use some puppet, or we can use some teddy bears for play, for like discharges energy through the play, like so they can it's more dynamic with children, but you can use their toys for the situation of trauma they've been, and you can kind of make some figure like winning in this situation and like this, if it makes sense. Yeah, like because they need more like playful way. Yeah. Yeah, playful way. Children, you can talk to them so much. You need to use like games, or like they use with tsunami, when they use like big like part of cloth, and they stimulate like wave from each corner, like big like circle, and they stimulate the wave, and children like run away. Yeah, so stimulate like run. Yeah, so we have to use like, yeah, but each therapist in somatic experiencing involve their own technique. Yeah, I work a lot with craniosacral. Somebody use like some Feldenkrais. Depends like what they are trained in. Yeah. Did you watch any Peter Levine videos, or like, yeah, or books? Yeah. Yeah. So what else? More question? What did you like the most about the lecture? What was the most interesting? What was new for you? Mm-hmm. Thank you. Somebody signed off. I think these days it's more awareness of the trauma. I think it's very good. Like we can have more tools, like how to work with this, and yeah, amazing. So I just want to say, yes.
I was just going to say, I just like hearing about the different ideas, that you have, because it helps, you know, like the idea of the body, you know, actually my supervisor suggested that the other day, to have the shape of the body on a piece of paper, and then, you know, to ask the client where, you know, say where this one, lots of somatic trauma, you know, which parts of her body she felt warmth towards, say, for instance, or which parts were most difficult for her. Yeah.
Yeah, that's good. Definitely, it's good. Yeah, definitely. Okay, so maybe we will do more lectures or like something in the future. So I have your emails, everybody, and yeah, I wish you beautiful summer.
Thank you.
And we will be in touch. And if you want, you can connect with me on WhatsApp, and we can chat. Yeah. So thank you so much.
Thank you. Thank you.
Thank you. Have
Thank
a
you.
great
Thank you,
evening.
Lenka.
Thank you.
Bye.
Thank you, Lenka. Thank
Bye
you.
bye. Bye bye.
Bye bye.
Bye.
Good night.
Bye bye. Bye bye. Hello, Simon. I haven't seen Simon yet. No, I can't hear. I can't hear. Hello.
Říkám, že nejsem Simon, že jsem Kateřina.
Aha, Kateřina, jo, tak si rozuměla. Aha, dobře.
Já mám vypnutou kameru, protože tady večeřím. Já mám
Ty
být
v Anglii,
za 15 minut na tenise, ještě jsem musela udělat klukovi večeři, když jsem přišla, takže jsem přišla pozdě a teď tady nenápadně jim.
Super.
Proto jsem byla vypnutá.
Tak jo.
Díky.
Tak jo. Díky,
Hezký večer.
hezký večer zatím.